for this, I'll actually reference Alicia Morali's work. She published a poster at the Canadian Association of Pharmacy-Oncology conference in 2020. It was a virtual conference. It was entitled Current Pharmacy Practice in Cardio-oncology. And she interviewed pharmacists who practice in a variety of settings and offered care to patients who were at risk of or experiencing cardiotoxicities to gather their impressions, their attitudes, what they thought were the successes and struggles of serving this patient population. And so in terms of placement, the current landscape, they really were everywhere that a patient might be seen. And so there were folks in ambulatory care clinics as well as inpatient, some were in a community type of setting as well. And they were involved in assessing the patient's cardiac risk factors, optimizing medications there, assessing the different types of cancer treatment that they might be receiving and the risk of cardiotoxicity, offering tailored education based on the patient's understanding and their goals of therapy, and assisting with guiding decision-making while working in collaborative care teams. They engaged with patients and families in person and via the phone. So some of the challenges include integration into that patient care process. So this is still somewhat of an emerging area, there are some institutions with cardio-oncology clinics that are specialized and dedicated to identifying, monitoring, assessing the risk of cardiotoxicity, managing patients that develop cardiotoxicity, addressing whether prevention might be an appropriate strategy or close monitoring and then early treatment. And so that variation still exists. Some of the pharmacists that Alicia had interviewed mentioned that was challenging to identify where they might optimally or best serve the patient during that journey. Also, as the field starts to emerge, there are a small number of pharmacists currently practicing in this area is my impression and her impression. We're hoping that as that increases, there may be an appetite to form a community of practice, to collaborate with each other, to share learnings and insights in terms of approach, share clinical knowledge, and collaborate in that sort of way.